When I think of QI, quality improvement and quality assurance, I think of three main differences. And not to say that they're bad, I think that both are essential. I think that it's essential to have both quality assurance and quality improvement. But I think of three main reasons, and at the end you might see I have a bias of one over the other. The first is on who initiates the conversation. Our hospital leadership might still decide that we need to embark on a quality assurance process, but the person or the body that dictates the goal that you have is an external body. Normally, it's an external assurance process. Example would be like the Kenya Quality Model of Health, Safe Care, JCI, ISO. All of them come and tell you these are the standards that you need to attain for these reasons, and you're assessed on whether you hit those standards, and there are sometimes repeat assessments to retain your certification. When I think of quality improvement, the person who speaks of what the goal is the individual or a team in the hospital. It's a team or a person to say, I am not happy with something, how something is running, and you get a team to ask yourselves, why is it not working? What can we do different? Has what we have done worked or not worked? And so there's that difference. One, it's someone telling you you need to attain these goals, but the other is saying, no, the following things are not working and I'd like to work at them to make sure that they're fine. The second is the process of the quality assurance and quality improvement. In quality assurance, many times it's assessors coming, doing a tick box. You may form teams. You may say, we need to hit 90% of all these boxes done and checklists. And in quality improvement, there are just different variations of the plan, do, study, act. But at the end of it, we have a goal, we have an intervention that we'd like to do, we do it, and we measure if it has worked. And there are those differences. And there are even different tools. Like for the quality improvement, many tools, some would use a root cause analysis, others would use a fishbone, others would use the 5 whys, others would use Sigma. I mean, there are different tools to just say, how can we continue to improve what we're doing? But in quality assurance, it's often more direct and checkbox. And finally, the third difference in which I look at is sustainability, which cuts across both of them. For both quality assurance and quality improvement, you have to think of how you will sustain the gains you've made. How do you secure your wins? I think that oftentimes, because a quality improvement process is more involving, requires more time and commitment, often digs through different issues and challenges and concerns. Often it is easier, I think, to sustain the gains that you've made in quality improvement over in quality assurance, where commonly one of your sustainability plans is, random audits or spot checks and things like that. When I think of an example, for us in the hospital is our waste management process. It's something that we continue to work through, and this might be true for many of us. I think it's an example I hope many would identify with. When we began looking at our waste management process, I initially thought, let us just have the things. Waste bins, check. Waste liners, check. CMEs, check. Labeling of the bins, check. All of that was in place, but you still find that we still had a challenge, and it calls for looking and asking, why do we still have this challenge? And it then now takes you to the next process to get a team and ask ourselves, why isn't our incinerator gentleman in PPE, yet the PPE is there for you to discuss with him and find out our supplier only has 2 sizes of industrial gloves, for instance. And therefore you have to just go back to the procurement process and say, I need industrial gloves of different sizes that can fit different people so that everyone is in adequate PPE. Just going through those different cycles to reach your team's goal.